And as Arkansas deals with another massive spike in COVID cases, the best treatment for the virus, well, I'm sorry to tell you, is running out. Katrin Asaf is live at UAMS, where the last few treatments of monoclonal antibodies were used up today. So, Katrin, what does this mean for everybody now?
Well, Donna, basically what it means is that unless you're one of those worst COVID cases, the type that hospitals like UAMS are seeing in their emergency departments and ICUs, you're not going to be able to get that treatment. All you can do right now is do what medical centers across the state are doing, which is waiting and hoping for a new shipment.
I wouldn't wish this on anybody.
When Kat Robinson was diagnosed with COVID just days before the new year, her symptoms were textbook.
I had extreme fatigue and body aches.
But so was her treatment. Robinson was able to book an appointment at UAMS for monoclonal antibodies, what doctors consider the best way to tackle the virus.
I just went for one session. The session took about 2 hours in total. By the time the antibody treatment was completed, I was already starting to feel better.
But the success that Robinson had is now hard to come by.
It is in short supply. That's without any question.
UAMS started Thursday with 16 monoclonal antibody treatments. They ended the day with none. Baptist Health in Little Rock says the few vials they have are being saved for the worst cases. With states relying on the federal government for shipments, it's not clear when we'll see enough.
We've been getting a consistent level of supply. It is just insufficient.
A trend that worries Robinson, now fully healed and back to work.
It's very alarming to me.
For those fighting the virus at home, she says there's only so much to do.
The number one thing that you can do is rest.
Now, Robinson also encourages precautions to take so that you don't have to be treated. Things like wearing your masks in crowded locations and getting your booster shot if you haven't done so already. Now, we are not sure when more of those monoclonal antibodies will arrive in Arkansas, but Governor Hutchinson in a press conference recently did say that he has asked the federal government to add more. Reporting in front of UAMS, I'm Katrin Asaf. Donna.